This presentation is a policy and ethics in public health case study, the depletion of Ogallala Aquifer and health effects. It's for MPH 5900, Emerging Issues in Public Health Policy and Ethics. The instructor is Dr. Krista Schumacher, and I'm Sharon Robbins, I'm the presenter and the student. The World Health Organization in 2010 stated that humans have the right to sufficient, continuous, acceptable, physically accessible, and affordable for personal and domestic water use. Oklahoma has a responsibility for managing the state water supply while the federal government oversees the quality of the water. In the United States, since 2015, 46% of the population have depend on this groundwater that we have here in our country. The greatest amount used is agriculture to feed the population. So when I talk about groundwater, what do I mean? Do I just mean a well? Do I mean anything else? No, I mean an aquifer. An aquifer is an underground layer of water-bearing sand or rock or some penetrable ground layer. A confined aquifer is a water-bearing stratum that is confined. It has an overlay of clay or rock. Unconfined has surface water infiltration. And it can lead to pollution, overuse, because it's easily accessible. So what is potable water? Potable. It's drinking water. It's water that we can use for domestic and personal use. Non-potable is surface water that hasn't been treated, creeks, concentrated rainwater, any kind of water is not safe to drink or eat. In 2023, the New York Times provided evidence of the current and possible future groundwater aquifers depleting. And it's threatening our future. Change is already happening in the states around us. And in Kansas, for instance, 2.6 million acres of land no longer have enough groundwater to support large-scale agriculture, which means less crop. They have falling water levels in the western part of Kansas, and it has very much declined over the last few years. The news report stated there was little or no comprehensive data on groundwater levels nationally. And so they went out and sought it for themselves. And on that website, you will see quite a few maps, and I suggest you go there. It's a great article. There is no attention. The reduction of water by cities and company. I mean, we need to look and see what's happening. And of course, the federal government only sees over the quality of our water, so the state is the one we rely on. And without federal backing, sometimes the state doesn't have a lot of power. In this area, we depend on the Ogallala Aquifer. Now, the Ogallala Aquifer spreads over 8 states. It has the northern region, where there's Colorado, Kansas, Nebraska, South Dakota, Wyoming. The central includes not only Colorado, but Kansas, Mexico, and Oklahoma, our region, and Texas. And in the southern region, there's New Mexico and, of course, Texas. The aquifer underlies 174,000 square miles across the high plains. And in some areas, it's 1,000 foot deep. Some other areas, it's 54 foot deep. It is shallow, it is not confined, and it is being drained rapidly. If you can afford it, you can pump it. So says the Water and Water Rights of Oklahoma Statute, subsection 82. Insufficient regulations for overpumping have caused quite a few problems in this area. Our aquifer, as I said, is draining rapidly. The Panhandle Watershed Plan and Region Report states that by 2060, we will have increased our pumping by 81,350 million gallons a year, and we'll have drained the aquifer. 2060, we will be without water. We do not slow this down. The lack of federal oversight protecting our groundwater is not helping. We need to find a way to protect our resource. The map in front of you shows that the Ogallala Aquifer in red is one of the highest depletion rates, and it has excessive pumping. The level has dropped by over 100 feet to half saturation thickness by the year of 2018. This slide shows that the highest rate of withdrawal of the aquifer are Nebraska, Texas, and Kansas for irrigational purposes. Since 2015, if you can count the squares, which is 15 million gallons a day, it might alarm you to see how many gallons have been pumped out of that aquifer a day. The U.S. Drought Monitoring Report map shows that the recent precipitation we have had in the panhandle of Oklahoma has done much to alleviate our long, drawn-out drought. But the rest of the high plains throughout here over the Ogallala are still experiencing drought and are still having issues. As in the Dust Bowl days from 1930 to 1939, when there was no water, there was drought. If we don't have this aquifer, we will have drought. And there will be no water unless we have precipitation to keep us here. Without water, there won't be crops. Without water, there won't be a village. There won't be a town. There won't be ranchers and farmers. It will be dry land, arid, and depleted of moisture. The Dust Bowl days of the 1930s were the worst of the Great Depression, where severe drought hit the North America Great Plains. Between the United States Civil War and the 1930s, the Great Plains were converted to cropland and to rangeland. And then there was a lack of water. Drought hit. Sandstorms, dust storms blew up into the air. Americans starved, animals starved. Some animals even suffocated from the sands. People had to leave. There was no way to stay. They went to Oklahoma. They had to go to neighboring states. And this picture behind this shows a Sunday afternoon on April 14th, 1935, when a huge storm hit the Oklahoma Panhandle. Dust Bowl is a possibility if we don't do something, because in 2060 we'll run out of water. The health effects of a drought. My concern are the health effects. And from the CDC in 2020, here are the health issues when it comes to drought. Drought can bring about many health problems. Drought can also cause long-term public health problems, including shortages of water, impacts to air quality, sanitation, and hygiene with the dust blowing through the wind, more disease because there's a concentration of stagnant water, and West Nile virus is a possibility of what we need to look at. We need water for sanitation and waste. We need water for personal hygiene. And these are something that is incredibly necessary for good health, though not as vitally important when the surface water drains. Recreational sports can be a problem because you don't know what you're going to hit down there. The spread of diseases is something they brought up that's very important. Lack of hand washing. If there's water scarcity, you're not going to wash your hands as much. And then farmers may be forced to recycle irrigation water, which can cause bacteria harborage, and E. coli and salmonella can spread through the crops, and of course then spread to us. Increasing migration of animals toward any water source they can find, which would be more commingling of human and animals. Rainwater collection will be happening more often, but it can become stagnant water if not used. If it isn't treated, it can have an insect harborage. It can multiply diseases, bacteria, viruses, pathogens. So what are other people doing around us? Well, I looked, and Kansas have groundwater management districts, and I looked at the Big Bend, groundwater management district number 5, and they established purposes of the district. And this is just a few of them. They established a water quality monitoring program. They discouraged the waste of water. They developed an educational program to explain how to use water and not waste it. They encouraged accurate production measurements based on the water used, how much crop is being produced. and how much water is being used. They review and authorize the annual appropriation of water usage. They oversee how much water can be used in the area. And they are now exploring development of artificial recharge, which is possible in the future, that in order to recharge the aquifer, because it depends on precipitation going through the surfaces, we may need to recharge in the future with water from the surface. Here is proposed policy for water. It came from the CEO Water Mandate of 2010, which are businesses that are coming up with policy to sustain water management. They see a problem and they are stepping forward. So in order to support sustainable water management, it needs to be social. Everyone has a right to affordable and adequate water. That should be important. It should include environmental issues, which is the protection of our ecosystems, the biodiversity, our animals. It should be economical. It should have water management. It should be affordable. It should be effective. And institutional. We should have the resources to have a water management oversight committee, a coalition. We should support legislation for water planning, for water management. And we should communicate, educate everyone on what is going on, to the residents, urban and rural, to the municipalities, to the local governments, to industry. Make it understood that we're not going to have water forever. So with my policy, I propose a community coalition, a workforce, to manage water, and it should have the stakeholders of the area. This is not all of them. This is a few that I've come up with. The city and the county governments, the city residents, the urban residents, the industries, the municipalities, the local health department, and others who are included in this area that uses this water. The policy says we should lobby, and we should, for the protection of the water supply. And we should seek our government to enforce on the waste and the pollution of water. Don't overpump. It's important to conserve this resource. The next step, of course, is to communicate the problem. Introduce a new policy to the new coalition. We are the responsible ones. Conservation is the #1 goal. Let's not waste. Use social media. This is an idea. Educate on aquifers, water conservation, water protection, and the future goals to have water beyond 2060. The ethical considerations for this policy are: do no harm, protect and manage our water source, keep the pumping down so that we don't experience another Dust Bowl and health-related issues, efficiency. We need to protect this natural resource so it is not wasted. Overpumping by anyone is waste. Justice. Everyone has a right to potable water. Proportionality. Not one person has the right to waste water. We need to share. In summary, the Ogallala Aquifer, our water, our drinking water, the water that we use, is being overpumped. We need new policy now because the policy we have is not being enforced and it's not enough. We need a coalition of community so we can make a difference. If no one's going to do it, we're not going to do it. We can use education, communication, cooperations between each other. We need to lobby legislature for new policies for groundwater protection. We need to understand that no one can do this alone. It's going to take a village. But with many voices comes change. I provided with references so that you can go ahead and take a look at where I've been and what I've seen and what I've read. As with this page, the same thing. These are my references continued. Thank you for your time. I hope you have a wonderful day.